Asking for help can be hard, but the folks at Aurora Mental Health Center want you to know that you're not alone. September is National Suicide Prevention Month, and Erin Ralston, clinical manager of Aurora Mental Health's Connect to Care program, talks about how we can help the ones we love. So Erin, suicide obviously is a very hard thing to talk about for so many people, correct?
Yeah, there's a stigma associated with mental illness in general and definitely with suicide. We have some fear around talking about something that is so related to pain, right? A psychological pain that we can't see or necessarily understand.
So then, this is the big question. Hope you have enough time, but how then can we actually talk about it?
I mean, I think the very best thing is to just be transparent, to own that it's scary to talk about and to do it anyway, right? To say, are you having thoughts of suicide? To say, hey, I've noticed that you're struggling lately. Have you had any thoughts about killing yourself? Saying the words really takes some of the power away from the stigma. And we can do that for each other and for our communities.
So obviously, most of us are not health professionals. What can we do or maybe not do to make sure that we care for those that we love?
Yeah, you're the link though, right? You're the person that notices that something's going on and can be there to help connect that person to a professional. Presence is so valuable because that person may or may not be able to ask for help. And yet you can be the person that says, hey, I can help you get there. Let's call the crisis line together. Let's look for a therapist that you could talk to about what's going on. Let's go to a movie. It doesn't even matter if you're doing something that is specifically mental health related, as long as you're actively present with that person.
It's been a crazy year and a half. I mean, unprecedented. How has COVID impacted suicide rates?
We have really early data right now. What we know about disaster situations, a global pandemic, of course, being a disaster situation, is that the compounding factor of adding a pandemic on top of the crisis that we're feeling already in our lives and all the different stressors going on makes it more difficult to cope. So we see, folks that maybe were having trouble coping pre-pandemic are having more trouble now. And those folks that were, seemingly well adjusted before the pandemic may be having trouble coping. And so we need to recognize for all of us that the stress levels are higher. We need to do more to take care of ourselves, more related to our health and our mental health.
Well, let's talk about isolation. Obviously, the pandemic has caused so many of us to be more isolated. Can you explain a little bit more about what some of these feelings might be coming up that we're experiencing right now?
Yeah, isolation is so important to think about because the more isolated we are, the less intervention space there is when someone is having thoughts of suicide. And isolation can look remarkably different for different people. The best way to know how it looks for a person is to ask. But we think about it kind of on two ends of a spectrum, where one end of that spectrum is that they may literally not talk to another human being for days. It's not something that really happens in their normal life. And, the other end of that might be someone who is fairly extroverted and spends a lot of time with people, and yet in that space with other people feels entirely alone and that no one else would understand. So that whole spectrum really looks so different, and we need to be asking those questions.
Is reaching out, picking up the phone, I mean, are those just simple things that we can do to actually help those who might feel isolated?
Yeah, so simple and yet hard to fit in a day at the same time, right? But making a phone call, sending an email or a letter, asking them to just go for a walk. It's not a lot of time, but we know based in suicide research that something as simple as sending a postcard can be impactful to a person because it helps build that feeling of connection. So any of those are certainly beneficial, and we encourage everyone to do that for their communities.
All right, so tell us about the Connect to Care program.
Connect to Care is our access clinic at Aurora Mental Health. So our role is to help people get connected within the Aurora Mental Health system to whatever care is most appropriate for them. Our goal is to be a wide open door and really set up a treatment plan with someone based on what it is that they want and need.
All right, Erin, we appreciate your time. Thank you. You are not alone, and they are here to help. Learn more about the Aurora Mental Health Center at AUMHC.org, or by calling 303-617-2300. They paid for today's segment. Stay with us.